All right, welcome back to Daybreak. Of course, this is the time that I want us to take a look at some of the stories making headlines and having a discussion about what we are seeing in the pandemic, especially in the country. I want us to start by looking at the numbers as of yesterday, as they were announced by CAS Rashid Aman. And first of all, the state of the war, we have well, these are not the correct graphics. We wanted to look at the latest in as far as the numbers as done by Secolia that would indicate how many infections we have. There are more than 13,770 because of the extra 418 infections that were announced yesterday out of a sample size of 2,474 to give the total of 13,771. Let's take a look also at what that means. So yesterday, because of those 418 new infections, 292 were in Nairobi, Kiambu recorded 54, Machakos 28, and Kajiado 13. In that order, the other counties that were also affected are Mombasa with 6 infections, Narok 5, Meru 5, and Kitui 3. So we'll shortly be bringing you how those trends are behaving. But first, let's listen to Dr. Rashid Aman as he spoke yesterday, talking about the numbers that we're seeing in the recent days, having hit a high of 688. I believe that was on Saturday. Listen to him.
Should worry anyone who cares about our country, and that it is not business as usual. This situation should jolt us into action and ensure that we strictly adhere to the containment measures spelled out to curtail the further spread of the virus. However, it seems that this message has not sunk very well among our people. In the past few days, we have continued to witness misbehavior by some Kenyans, including some of our leaders who are hell-bent on flouting all measures that have been put in place. I am saddened that particularly here in Nairobi, where the numbers are growing in their hundreds every day, a lot of people do not seem to care and have thrown all caution to the wind.
All right, that's Dr. Rashid Aman speaking about the numbers that are seeing the country, especially in Nairobi. I believe on Saturday we had more than 500 new infections being reported. And to speak to us is Dr. Susan Kagusha, who is a public health specialist, as well as Senator Sylvia Kasanga, who is a nominated senator from the Wiper Party. Good morning, both of you. And let me begin with you, Dr. Kagusha. So we are seeing these numbers, and especially in Nairobi. What does this tell us about the community transmission, and what do we need to do to avoid this infection?
Thank you, Sam, and thank you for having me on the show this morning. What we are seeing, the trend is really not very good. What we are seeing is that the numbers or the cases, the caseload is still very high and rising by day. Nairobi, for instance, in the last 3 days, it has recorded a high of 1,200 cases. Now that is very telling, because it means that the public health measures that we are supposed to be putting into place, maybe we have relaxed on them. And of course, if you go around the town, you shall see majority of people are back to town, and people are almost back to their normal duties. So it's not a very good trend in terms of the way we study disease, because we are nearing the peak, and sometimes we talk about an exponential trend where we are seeing the numbers really going high, but we are not yet peak. And sometimes you might not even know that we have gotten to the peak. But in the near future, in the coming days, we might be recording higher numbers that we can actually see. But the sustained number of high numbers of number cases, then it is not a good trend. It only tells us that we need to tighten the belt more in terms of taking care and ensuring that the measures are put into place. Now, individual responsibility here is what is going to save me and you and everybody. So you realize the government has reached a point where now we're talking about each one taking responsibility, and also making sure that you're taking into account all the measures that are needed, use of mask, washing of hands and such, so that then you are able to protect yourself and protect the person near you.
Right. And Senator Sylvia Kasanga, you are the Vice Chairperson of the Senate Ad hoc Committee on the response to the coronavirus pandemic. Did you foresee a situation that would be reporting such a number of cases? And when you were having these discussions, even at the onset of the committee, what measures did you suggest that would be taken that now we can be in a position to see whether they're being taken or not?
Thank you so much, and thank you so much for calling me again. I have not been with you for a long time. I'm happy to be back here again. You know, the ad hoc committee, our main purpose, of course, was to interrogate and to help Kenyans, be like a go-between Parliament and Kenyans, sorry, between the executive and Kenyans. That's really the role we are playing, to almost oversight what the response team was doing. So our task, of course, was to engage with them, see whatever strategies they have put in place, and then come and speak to Kenyans and hear from the stakeholders as well. Is the government doing what needs to be done? That was really our purpose. As you know, we have had a lot of engagement, both with government and stakeholders. We've had over 70 meetings, all of them mostly virtual. We've had only 5 physical meetings. We've even had a chance to do some county visits before, of course, the pandemic now got to its worst. We did manage to do some county visits in Meru and in Isiolo, and we've given our feedback and report on the preparedness of counties. We've met with the governors as well, the Council of Governors, to see the preparedness of counties, and we've raised a lot of issues. We've also come up with issues from the stakeholders, which we have put pressure on the government to make sure that they can implement, so that at least whatever that can go on in terms of business, especially when it comes to transporters and others. And also frontline workers. You know, there's been a lot of complaints on frontline workers and access to, protective gear especially. And you see that is still ongoing even now. And we've had conversations with people like KEMSA as to why we are still having these challenges. As well as in the counties, we're asking the county of governors, why do we still have our frontline workers so exposed, and yet they're the ones we are depending on? So as a committee, our task has been to be the go-between, put pressure on government to see where we are going, and also communicate back to Parliament on some of the things, like you can hear Dr. Rashid saying that it is not business as usual. So some of our task has been to go back and talk to our members of Parliament and tell them the word that you need to be spreading to Kenyans is that it's not business as usual. And we knew that the numbers would rise. We had been forewarned. Our conversations with doctors, because we've had a lot of conversations with the doctors, especially those who are advising government, we have seen their projections. We have seen that it was estimated that there's going to be a peak. We are beginning to feel the pressure of the peak. It is still at the beginning. It is going to get worse. And that is why Kenyans are being called on now to take individual responsibility. You remember that the government had to open up for business. If you were listening yesterday to the AMREF CEO doctor yesterday, when the response team has to sit, they have to look at the economy. As you know, our economy is fragile. So lockdowns were causing a lot of pressure on the economy. So we couldn't continue the lockdowns. And this is why the government is saying it's time now to take your own individual responsibility. And you can see the government is trying very hard. You can see them going around the counties also to assess on the preparedness, because the response team is supposed to give support to the response teams in the counties. And we have seen how, as a committee, we've interrogated that kind of relationship. And we've seen the counties that have been forward when it comes to the fight have also set up their response committees. We've seen that they've set up, you know, at their county level, and they have cascaded down to the ward levels. We have seen in some counties where Nyumba Kumi has become very strong, meaning they're able to track and trace, and as well as send the message that Kenyans need to be more careful, wash your hands, social distance, adhere to the curfews that have been given. And really, it's a call now for Kenyans to take individual responsibility, like the doctor has said. So Rashid, as a committee, we've interrogated a lot of issues. If I was to give you a report now here, would go for several hours.
Right, Senator. And of course, I hear from you of the reviews that you've been conducting and making sure that counties and sub-counties are doing what they need to do. But Dr. Kagushia, so yes, the preparation can be there in terms of the structural preparation when you're talking about the administration and the hospitals that we have in the country. But then again, the numbers continue to rise. From a public health perspective, what do you think we are doing wrong? Because when you look at the numbers, yes, Dr. Rashid Aman says that the spread is more in Nairobi, but Nairobi was never under lockdown within itself. So are we seeing any pattern that you would attribute it to the relaxation of the containment measures?
And I think it is very clear that relaxation of the movement, or rather the measures that we are supposed to be taking for public health to avert this particular disease have actually been relaxed. Even at individual levels, you can actually go to the community and see, and even in towns, you see that people, even use of masks, people are not too careful on use of masks. People are using one mask throughout. You'll find someone leaving their mask in the car, and then tomorrow they just pick and use it again, which is not a best practice when we want to avert this disease, because the virus, right now, it has been confirmed by World Health Organization and research that it can actually survive in the air as well. So, and on the surfaces. So what we are seeing is that, yes, we had projected this and we were to see this particular trend, but it is worrying to see that after the relaxation, yes, we can attribute to some extent the rising numbers of the cases of COVID-19 to the relaxation of the measures a bit. And again, we also projecting that even with the opening of churches, if the measures are relaxed more, then we are likely to see even higher numbers. The projections are clear, and when you're doing epidemiological modeling, usually the way people behave in terms of taking into account and the right measures of public health to avert the particular disease, then if those measures are relaxed, the cases are going to rise rapidly. And
but Dr. Kagushia, the reason I'm asking specifically about Nairobi, because if you look at the numbers, they are rising in Nairobi, Kajiado, Machakos and Kiambu. Part of this form the Nairobi metropolitan area, which previously before July 7th actually, they had been under cessation of movement, but the movement within themselves was still going on. So is there evidence to attribute these surging numbers to the relaxation of movement?
Well, Sam, I would say that what we are seeing even within Nairobi, remember Nairobi from the word go was actually a hotspot. It was a hotspot county, and the counties surrounding Nairobi as well were also hotspot counties, or rather were recording higher numbers. So what we can see as relaxation of the measures is attributable to the rising cases, or the exponential rise in cases that we are seeing. However, remember, we still have people who are now moving from other counties now flocking Nairobi. Remember, Nairobi is a central business district, and therefore a lot of business occurs or rather happens within Nairobi. And so what we are seeing is that those people who are coming now to Nairobi even to do business are very much exposed if the measures of public health are not put into account and in the best way possible. So yes, it is attributable to the relaxation of measures, or rather opening of the economy. Of course, we cannot continue closing the economy, and that is why government has called upon each one of us to exercise individual responsibility when we talk about hand hygiene, and including respiratory hygiene and all the public health measures that we need to put into account to avert this particular disease. So it is highly attributable to the opening, because remember, from the word go, it was actually a hotspot.
Right, of course, I will be talking about what corrective measures we can take. But before we do so, Senator Kasanga, so now you've been at the committee for those months, and you're saying that you've done quite a bit of work in reviewing the capacity in the counties. But beyond the bed capacity, what would be your comment from what you've seen in as far as the ability of these counties to handle especially severely sick patients? I'm talking about the ICU capacity, the healthcare workers that need to work in such kind of facilities. What do you think is the capacity at the moment?
The capacity is low. That's a fact. And I don't think that we were going to get to a place where we can say we can up the capacity to where it is supposed to be. The strategy has always been a preventive approach, that we prevent many cases from getting to the need of ICU. That is the best strategy for our economy, for instance, an economy that is ours. And that is why you saw the government taking the approach of cessation of movements at an early stage. The idea, of course, was to slow so that Kenyans can get more awareness, that Kenyans can prepare individually as well, and as well as the governments, all of them, national and county governments, to prepare for other strategies like home care, and things like that. The idea was to slow down such that Kenyans don't get to the point where many of them need to have ICU facilities. When you listen to the doctors, and they have spoken on this platform many times, by the time you get to ICU, the chances of survival are very low. So the idea is that let's not get to the point of ICU. Let us let's follow the protocols that we've been given. Let us social distance. Let's not get ourselves sick, and let's not get our loved ones sick by just taking care and following the protocols that we've been given. That was really the strategy from the word go. So as long as Kenyans adhere to the protocols, we shall be okay. We shall be okay, because each county was supposed to have at least 600 isolation beds and about 30 or so ICU beds. Okay.
Right.
ICU is meant for the most critical, and we hope not to get there.
Well, Senator, just confused me there, because the number we've been working with is about 300 isolation and treatment beds. You said 600.
Sorry. My apologies. Sorry,
okay.
my apologies.
Okay. All right.
300, yes.
No problem. So, Dr. Kagusha.
Yes.
It's okay. Dr. Kagusha, so now we know that the disease is in the community transmission is high, but also there is a disease that is coming up in those communities, and you're talking about the mental health, talking about the psychological situation of both patients, the families of those infected, but also those that are negative, for the fear that we are seeing that you might be exposed without knowledge. How are we dealing with this, and what do you think, how much of an impact will this be to the community?
Thank you, Sam. I think from the word go, there was fear about COVID-19, contracting COVID-19. Right now, we are moving towards community transmission is deeply rooted within our communities. And it is evident because most of our counties have actually recorded a case or two, and the hotspot counties have recorded even higher numbers. So what we are seeing is that there are other diseases that are also coming with the pandemic. Remember, when a pandemic hits, other diseases, majority of other diseases are almost forgotten, because the whole focus now moves from every other aspect now to counter the pandemic. So what we are seeing is that, yes, there are other issues within the community that are rising, and mental health is one of it, because, of course, remember, with isolation and staying at home, there are no interactions. And remember, from the definition of health, from the World Health Organization, is that health is totally a complete state. So today you're well, tomorrow you may not be well, of physical, social, and mental well-being of an individual. And so when you look at those three aspects together and now put within the environment, because we usually say that disease does not occur actually in a vacuum, it occurs in a host, that is an individual who is actually susceptible to this particular disease. So putting all that aspects together, we are seeing that other diseases within the community are rising. And yes, there are trends that people are not visiting the health facilities for care, but that could actually insinuate that people are putting public health measures into account. And where they are not, then people, because of fear, people do not want to go out or rather to visit the health facilities because, quote unquote, people think that COVID-19 is actually within the health facilities. So we are seeing the health-seeking behavior and practice of communities and individuals changing rapidly. So in the wake of mental health and other neglected diseases, especially the non-communicable diseases. And remember, me and you, we can live with diabetes, hypertension for really a long while without even knowing that we have the disease. So in the event that care is not taken and you're not going for screening, then we risk a point where we shall have higher cases of other diseases that are confounding COVID-19. So it is already a risky trend. And so the health-seeking behavior of majority of the people of Kenyans have really changed over time because of COVID-19.
You raised a very important issue which I'll come back to, that is the pre-existing conditions. But before I do so, Senator Kasanga, you're a champion of mental health in the country. And of course, there's this expectation that we've been seeing. Of course, it had been predicted earlier on, or the stages of the pandemic, we've seen a lot of gender-based violence. We've seen a lot of families going without rent, having to change how they go around their businesses in life. How much of care are we taking, or are you putting into consideration when you're planning for the response?
Thank you again. Yes, I am a champion of mental health. I have been talking about mental health for the last 2-3 years. You know, it finally got the attention of the president. He put in a task force for mental health. They went round, they did what they did. They presented their report the other day, if you remember, when they were, I think when the president was giving his speech, they launched the mental health report. I think you saw the mental health report stopped just shy of saying that we have a silent pandemic, which is actually, in my opinion, it has always been there.
Right.
It is not silent anymore. It is just a question of giving it the voice, which is what we have been doing as advocates of mental health. And now, because of COVID, now it has gone to another different level, as you've heard Dr. Gagusha talking about. That is the status of our country today. The mental health scene is not looking good at all, and not enough is being done. As part of our work in the committee, we have really pushed for conversations on mental health to happen at the county level. We have asked governors to have safe houses for people who are crying out in gender-based violence and children who are being abused in their homes. We've called out for safe havens. And in fact, in our next round of interactions, which we are starting from this week going forward, some of the conversations we want to have with the county governors is we want to know how many counties have actually set up these safe havens for our citizens to be able to seek help when needed. Where are the call centers for mental health? And for any other patient or somebody who's being abused at their home, where can they get the first response? Who can respond to them in the first instance? These are things that we have been pushing. And more importantly, that I have to say here now that you've given me the opportunity, is the need for financing for mental health. I have had conversations right now with the response team asking, why haven't we not set up a response team specifically for mental health that can be funded on its own, that can have its own money to go down to the counties and help Kenyans? Because this is really a pandemic itself, and we shall see the impact now as we continue going into deeper and deeper in the COVID-19 crisis. We shall see how mental health is going to really come out and show its glaring face.
Right.
And Kenyans need to be aware, we need to talk more about it, and we need to support each other when it comes to mental health issues. So as a committee, we are really, really pushing on this issue. And when we meet with the CS next time, because he had promised us that he'll bring us a report on mental health the next time we meet, hopefully this week, I'll be personally looking forward to seeing what steps they have made. I have to admit, I've seen some communication that is coming out. We have now hotlines that when it comes to mental health. I've been having close conversations to some of the doctors that are on the front line on mental health, but we need money. Yeah, we need a budget line for mental health specifically. And I'm glad that the task force has recognized this. I'm glad that the National Assembly is pushing the bill that is going into second, because the next thing we must push for is money.
Right. And I hear you clearly. Dr. Kagusha, so now when you look at different countries and how they've been handling these mental health issues and the psychological wellness of patients as well as families and the community, what do you see and what can we do even as we wait for the authorities and hospitals? What can we do at the community level, like Senator Kasanga says, to take care of those that are close to us?
Thank you, Sam. And I think issues of mental health are usually very pertinent, and usually World Health Organization has classified mental health as a top leading cause of disease because it progresses. It's usually a silent killer because it progresses with time, really without coming out. And by the time you're realizing someone has a mental issue, any form of mental issue, then that is usually has already escalated. So looking at the best practices from other countries, and even here locally, starting with the local here, home, is that we need to engage more of health officers who can assess and diagnose earlier, in an early stage that someone is sick mentally. Because when you talk about mental health, in many instances, someone may not even know that they're actually battling the mental health until you stop someone and tell them, hey, you need to get a check. So, and with the continued isolation and staying away from, groups of people, social distancing. It means that people are now spending much more time alone, or sometimes on their screen working, and that is the next big thing, because we're talking about occupational health. So mental health then comes in, and we are realizing that here in the country, the government needs to engage more of health workers that can actually, and psychologists as well, who can actually diagnose as early as possible the mental issues, so that then this is addressed at an early stage before it progresses to the next level. Again, coming to look at community health volunteers, they are our frontline workers within the community. They work through community units, and these are people who, in their curriculum, they are usually trained to look out for telltale signs that someone could be suffering from mental health. And therefore, use of these community health volunteers is going to really be the game changer as we move forward. Because for you to be diagnosed by a community health volunteer, they only need to follow you for a while. And remember the trust that the communities do have with their people. They are able to interact freely with their people. And so you do not need to wear your best suit when you're interacting with your neighbor. So your neighbor, who is a community health volunteer, will be very quick to pick that there is an issue with mental health. Now, going out there, I think I like what happens in the US. There's something we call shielding. And when it comes to shielding, you're looking at those people who are living with comorbidities or those diseases that are making people more vulnerable to COVID-19, and shielding them, or rather making sure that you're taking care of them, you're not going near them, and you're also putting the measures that will protect them against getting COVID-19. So shielding works best, and if we employ that particular strategy here in Kenya, is going to really help us in terms of protecting those people who are more vulnerable to COVID-19 and other diseases. But mental health, Sam, as you put it, and as Senator Kasanga has put it, is a big thing. Before, it has been called a silent disease, but it is currently no longer silent, because many people are suffering from mental health and they're not even aware. So the task force that has been dealing with mental health and response to mental health has done good in terms of unearthing, yes, we have a problem, because the first thing to addressing a disease is actually appreciating and acknowledging that, yes, the disease is here and we have to deal with it in the best way possible.
Right, and yesterday there was a circular released by the head of public service, that is Joseph Kinyo. I want us to take a look at what he said in as far as this conversation is concerned. He released it and said that mental health and psychological support will be given by the government, especially for public servants or public officers that test positive of the virus. There are so many other issues that he detailed that we'll be looking at later on, but also officers that have recovered or were in quarantine now coming back to work will not be discriminated or stigmatized, and if anyone is caught stigmatizing such a person, then that is an offense. He does not say what will happen, whether you will be taken to court, but he says that that would be an offense. So of course, now we are saying that at the workspace, the government is already giving directives on what should happen. But I want still to go back to the home, Senator Kasanga, because Dr. Kagushe there alludes to what some of the concerns at the family level. I have been having conversation with people who may be contacts that are being traced or people that have gotten infected. And one of the biggest worries is how to deal with their children, especially the younger children, how you have to explain to them that you cannot come close to me, that you cannot meet me, especially when it comes to home-based care. How are we dealing with this from a policy point of view, and also what you can advise to the response teams?
Oh, the issue of children and children suffering during this period has been a large conversation. I've been having these conversations, especially with psychologists and other frontline workers. As you know me, I'm personally not a practitioner, but we've had these conversations on how do we help the child, especially when you hear stories of, say, nurses who are working on the front line and they go home and cannot have contact with children. How do you help such a child? And it all goes about how the conversation around that child is supposed to be had. And it's a very delicate conversation. And it also boils down to the kind of messaging that we are giving Kenyans on how to disseminate this thing. You know, when you speak about the stigma, for instance, when we talk about it as adults, we forget that our children are also listening, and we don't know what impact it's having on our children, for instance. And it goes into their hearts and it causes them a lot of anxiety and fear. And if we don't deal with it by communicating gently to the children and explaining to them, and also being cautious in how we have conversations around them, then it becomes a serious issue for the children. I followed the conversation of a doctor who contracted the COVID-19, and she had a 6-year-old child at home, and she had to have her husband, of course, speak to the child, make the child understand that you can't go to mommy. And in the end, because she got very critical and she had to be taken by an ambulance to hospital, the child, of course, needed that kind of support, which now she had to leave. But when she came back, thank God she got well. When she came back, now she had to sit with the child and explain to her the impact of these things. We are really going through unprecedented times. Let me tell you, it's unprecedented. We are all learning as we go. And I'm happy that a lot of conversations on helping each other are happening on different platforms. And my worry is always the people who don't have access to the internet to join into these conversations. Then what are we doing about those people?
Right.
And that is why in our fight for mental health, like Dr. Kagusha has said, community mental health workers, we know they're trained. They can be very useful in sending information.
Well, unfortunately, I appear to have lost connection there with Senator Kasanga, but Dr. Kagusha is still with us, I believe. And Dr. Kagusha, so as we conclude, so there's that question about the pre-existing conditions, people with pre-existing conditions, and also at a time that we are now entrenching home-based care. What are the protocols and what should happen if somebody has a pre-existing condition and they're not showing any symptoms of COVID-19?
Thank you, Sam. And I think the protocols are very clear on home-based care, where when we do screening for who is fit for home-based care, there are categories of people that are not fit for home-based care. Number one, if someone is under the age of 5, those are toddlers. And number two, those people who are living with the comorbidities or other diseases that are compromising their immunity. Some of them is hypertension, diabetes, HIV and AIDS, cancer. If you're living with such comorbidities, then you do not fit to be offered home-based care. Number three, there are those pregnant women, because the immunity of a pregnant woman as well is lowered, and including, the senior citizens. We call them people who are 65 years and above, because, again, the immunity has disintegrated over time, or rather it has aged over time, and therefore they may not actually fight the disease in a good way. Therefore, you realize that for home-based care protocols, for you to qualify, there's a checklist that health workers are using, or rather they are supposed to be using, to qualify you for home-based care. Because for you to qualify, then you must pass through the checklist and ascertain that, yes, you are fit for home-based care. Number two, the facilities that within the home to offer you the home-based care are also very important as when it comes to assessing the way the home-based care is going to be offered at home. We are looking at homes where we have at least a room that is very well ventilated, and then we can be able to put you there, and you also have your personal facilities, including a toilet, including somewhere you will not be able to interact with the rest of the family. So, and again, at least the connection to a health facility and contacts as well, that in case you deteriorate within a given time, because remember, for you, when someone is suffering from COVID-19, the disease progresses very quickly, and then progressing to the next level, or rather from mild disease to severe disease, is actually very quick. So those people, again, who have signs and symptoms are not fit for home-based care. And again, those people who are recovering then are okay to be done home-based care. So looking at all those facilities, then community health workers again come into play, because these are people who are trained and they do understand how to look through and tell whether a home is ready for home-based care or not. So public health officers as well are the frontliners when it comes to home-based care. Psychologists again, so that they then take care of anyone who could be showing signs of mental health or mental health issues. Again, on children, it is a tricky scenario where your children have to be taken through, especially if they can understand that this is the disease that we are battling, or this is the situation at hand. And I think because of staying at home, the children now have come to appreciate and also to see that things are not okay. Remember, everything, because of now staying at home, we have all invaded their space. And so there's a lot of talking that is needed so that the children now come to understand. So the protocols are very clear. And so if they are done in the best way, it is the next game changer in terms of decongesting our healthcare system and our hospitals as well.
All right, and I'm sure we'll need more time to go into the details of home-based care as well as the matters to do with the caring for the younger citizens. But finally, Senator Kasanga, we have very few minutes, actually we're out of time, but so what are your parting shots even as we approach the next phase of the pandemic? We know that the President is just about to meet the summit of the governors and the national government this Friday. What is your parting shot that you think we need to focus on as we review the effect of the relaxation of containment measures?
Thank you so much. Sorry, a little bit. Maybe I can say to Kenyans that we have to remember it's not business as usual. What Dr. Rashid said is true. It's not business as usual. And there's a fear when you look at the international news that we are going to be in this situation for quite some time, because we do not see a vaccine until maybe towards the end of next year. So chances are that this is the way of our life for the next 2 years, possibly. And that is assuming there is going to be a vaccine that is going to be found. And we are probably going not to be, amongst the people who shall get the vaccine. If we don't get it ourselves, we will have to wait in the waiting line by the time Kenyans get a vaccine. So this is our new normal. Kenyans had better begin to internalize that this is now our way of life. And, just take the precaution. And my prayer is also that the media houses like yourselves can we highlight on some of the protocols that Dr. Gagusha is talking about, because they're there, they have been given. We know the protocols on office work. We know the protocols on home care. We know the protocols on schools, those that will be allowed to open, the TVET schools and the colleges and the universities. We need to have deeper conversations nationally so that people can interrogate and understand what it is that the government is trying to do. It's a preventative approach. We don't want Kenyans to reach the point where we need ICU facilities. As an economy, we cannot sustain ourselves with this disease when it gets to its highest points. So we have to be cautious and we have to take those extra steps.
Thank you so much.
Thank you so much. And for mental health, also let's continue the conversation on mental health. Let's continue pressure that we have funds that are put forward for mental health.
We will do so. Senator Sylvia Kasanga, nominated senator from the Wiper Party, as well as Dr. Susan Kagusha, who is a public health specialist. She's the lecturer and head of department in environmental health and disease control at the Jomo Kenyatta University of Agriculture and Technology. Thank you both for your time. And up next, we'll be speaking to the governors of Nyeri and Machakos County. Like I said earlier on, these are the initial counties that were piloting the universal health coverage. We'll be taking a look at the numbers in those counties, as well as how far we are and what we should be thinking about come Friday during the summit meeting. That is the meeting of the governors, as well as the executive arm of government led by President Kenyatta. We'll be back in a moment.